Hello and welcome to this family guide on using the Newcastle Model. This video will inform you about the expert care your family member will receive whilst in our unit. It will describe our approaches to care and explain the type of support that you can provide to us. Over the next few days and weeks, you will receive some forms and a phone call from our team. We'll ask some simple questions about your family member that will enable us to provide the best possible assessment and treatment. The questions won't be difficult and will simply ask about their likes and dislikes and details about personality and history. The reason for this is explained in the following video. Your family member probably came onto the unit because their behaviour was causing difficulties for themselves or others around them. There are different terms for this type of behaviour, but for the purposes of this video, we'll refer to these actions as the behaviours. The types of behaviours we see are not exclusive to dementia, and in certain contexts, many of these behaviours are common. It's also important to note that not all of these behaviours are antisocial. Many of them are everyday behaviours, like going for a walk or driving a car. These behaviours are now discouraged, as it may be dangerous for them to go out alone. Understandably, people may react badly to the sense that we're trying to control them. This is a common aspect of caring for people with dementia, and we call it the start-stop feature. We aim to stop people with dementia doing things that will cause danger for themselves or for others around them, and start doing things that will keep them safe. We aim to do this in ways that the person doesn't feel over-controlled. And once we've discovered the best approaches to use, we'll pass this information on to the family or care home who will be providing support and care after discharge. While this video will mainly focus on non-drug approaches to the behaviours, it's important to note that your family member will be seen by a doctor to see if any medication is required. There are potential side effects to some of the drugs which may be prescribed, so their effects will be monitored very closely. Psychosocial approaches are seen as an important part of managing the behaviours, so in most cases a combined approach will be used. We will also undertake a routine physical health check. Some conditions that are common in the elderly can create confusion, which can mimic dementia. This screening will check for these conditions, amongst other things. We use the term psychosocial because the word social emphasises the importance of the environment and the people around them, which is key in terms of triggering and treating the behaviours. During assessments, we look to the environment for patterns and triggers, as this will identify potential underlying causes of the behaviours. In many situations, it's these causes which we aim to treat. Trying to find these causes can be difficult for a number of reasons. Firstly, there's a poor link between cause and behaviour, and each behaviour does not have a single fixed cause. For example, someone shouting could be from pain, boredom, paranoia, or another reason. The second difficulty is that the behaviour might be the result of multiple causes combining together. For example, Joan hit her nurse because she thinks he stole her purse. This is because she can't remember where she put her purse, and she can't see it due to her poor eyesight, and has a lifelong fear of theft from a traumatic burglary in her early married life. Finally, research tells us that when someone displays one specific behaviour, they're likely to display 4 to 5 others. This suggests all behaviours stem from some underlying cause or causes. To deal with this complexity, we need to carry out a thorough assessment to find the causes and the best way to treat them, and this is where you come in. The information you provide us can help us to understand how the different factors in your family member's life are interacting to cause the behaviours. In the next few minutes, we'll tell you about the different types of information that will help us care for your family member. You may feel a little overloaded by the details, but please know that we're not testing you, and any information, no matter how small, will be useful to help us tailor our treatment. It's our job to sort out the information, and we're simply asking you whether you think there are important things we need to know to deliver good care. The assessment we use is called the Newcastle Model. It was developed in collaboration with researchers and care home staff in the northeast of England. Together they deduced that the key features of the assessment should be previous personality, including likes and dislikes, personal history, environment and routines, mental health history, physical health history and medication, intellectual and sensory changes which reflect the nature of dementia. Understanding the type of dementia and the stage it's at is important. Your loved one is likely to have a different sense of reality to others. They may be disoriented in time and place, and may be unable to remember what happened just a few moments earlier. It's important to note that having a different view of the world doesn't always mean someone will display behaviours, but it can cause conflict, especially when there's a debate over whose view is correct. Whilst we can assess some intellectual and sensory changes on the unit, we're particularly interested in your view about how these skills have changed and over what period of time. Anything your loved one has been struggling with and any skills that remain strong would be really helpful for us to know. We can use these strengths to devise activities and help prevent these skills from being lost. As we said before, some drugs used can have problematic side effects, and our staff want to make sure that all prescribing is safe and effective. So when we speak to you, we'll want to know about drug reactions from the past, including drugs prescribed for physical problems. We would also welcome your views about how your family member has changed since being prescribed drugs. Many people we see have a range of physical health problems causing pain and discomfort, which can trigger or exacerbate the behaviours. When we speak to you, it would be helpful to know of any conditions and areas of potential pain. We will also ask if your loved one has suffered from any of the following conditions: recurrent infections, delirium, dehydration and constipation, diabetes, kidney, liver or thyroid problems, excessive drinking or using illegal drugs or medication, recently or in the past, and any other conditions your family member has complained of or received treatment for. These are important to know as some symptoms mimic dementia, and so by treating them, we may be able to reverse some intellectual difficulties. It's important to recognise that a person's personality endures through the course of dementia. Your family member's individuality will be apparent in various ways and in preserved skills. For example, a retired plumber might cause difficulties if one day he thinks he's been sent to the unit to fix a sink. To help us understand your loved one as an individual, we'll ask you about their personality and how it may have changed. We'll be particularly interested about their likes and dislikes. This is so important that we'll send you a separate form about it. This form is called a personal profile and will include other questions about the person's life. This information will help us to make their time with us as comfortable as possible. Mental health problems are present across all ages, and past difficulties may re-emerge during current problems. For example, someone with social anxiety may struggle with the number of people on the unit. Brain changes in dementia can also cause new mental health symptoms, such as hallucinations, paranoia, and delusions. Therefore, in our conversation with you, we would like to know about any previous fears, anxieties, mood difficulties, etc. We would also like to know if your loved one has had any contact with mental health services or are taking any relevant medications. Environmental features such as brightness of lights and noise levels are an important part of whether someone feels settled. So we would like to know what sort of environment they're comfortable in. In this part of the assessment, we're also interested in how well they're able to cope independently. Do they get confused in their surroundings? How well can they perform daily activities? Finally, we're interested in the sort of relationships your loved one has with their friends and family, including their ability to recognise and communicate with others. This will help us to know how to best keep their relationships going during their stay. When we receive this information from you and obtain results from our own tests and observations, the members of the clinical team will meet and construct a formulation containing these pieces of information in relation to your loved one's behaviour. We recognise that this might look a bit complex, but remember it's our job to put all the information together and work out what's going on. All we ask from you is to give us the information and we'll guide you through the whole process. When we've checked through the formulation with you, we'll use it to create a personalised care plan. This is used by staff to help support your loved one, prevent the behaviours and treat behaviours if they occur, and it'll look something like this. So here's a quick summary of the things that you can do to help us. Provide information about your family member to help us complete the Newcastle Model. Complete the personal profile form, which includes details of likes and dislikes. Speak to us regularly about your views on your family member's progress. And if possible, collaborate with us to ensure we're providing the optimum care, assessments and management. Please know that if you're unable to provide any information for any reason, this will not change our approach to your family member's care. It will merely mean the quality of information we use will not be as good. If you have any questions about the information in this video, please contact the unit. Thank you for watching this video and taking the time to help us care for your loved one.